Here's 5 things I wish I knew before starting my surgical ICU rotation. The first one is how to interpret an SVV. If your SVV is greater than 13%, the patient's probably fluid responsive. What is SVV? It's a respiratory variation metric. So basically, how much does your stroke volume vary with your inspiration, your expiration phase? Next up, how do we triage hypotension? So 6 checks, it's my sequence every time. Look at the monitor and the lines, get an EKG, get a chest x-ray, get a VBG, get a CBC and a CMP, and then look at your SVV, and then branch. So it may be a hemorrhage, think about their history, look at the x-ray, their output, their drains. You can give blood or even start mass transfusion protocol if you suspect a major bleed. If it's sepsis, they might have a fever, a suspected source, or a VBG with a lactate. You can give fluids, start antibiotics, and think about source control. If it's a pump problem, look at your EKG, get a bedside echo if you have it, think about pressors or an inotrope. Number 3, how to interpret a TEG. Do they need platelets? I look at the ADP and the AA inhibition. If it's greater than 60%, then they're functionally inhibited and they need platelets. Give 1 unit of platelets and recheck the TEG. If it's inhibited again, give another unit. Number 4, mass transfusion protocol basics. Activate this early if you think that they're exsanguinating. And it's a balanced resuscitation, 1 to 1 to 1 of PRBCs, fresh frozen plasma, or platelets. Think about TXA, give 2 grams. You need to always think about your adjuncts. So calcium every 4 to 6 units because the citrate in your PRBCs binds your calcium. Make sure you're warming everything to avoid hypothermia and then reassess their labs and their ABGs as you're going. Number 5, how to triage hypoxia. Here's another rapid sequence checklist I use. Look at their equipment, the positioning, and the suction. If they're ventilated, you can assess oxygenation by their oxygen level and their PEEP, and you can check ventilation by their respiratory rate and their tidal volumes. Get a chest x-ray. Look at the ETT depth. Look for atelectasis, effusions, or a pneumo. I kind of get into my decision lanes here. Their secretions or atelectasis, think about a metaneb or suction. If you're worried about a mucus plug, think about bronching them. And then if there's a large effusion or a pneumo, they may need a chest tube. If they're tiring or in some sort of respiratory distress, think about stepping up your oxygen support all the way to intubation and ventilation. And then always look at your vitals. If they're unstable and they only have breath sounds on one side, this may be tension physiology requiring needle decompression and chest tube placement now. SICU is all pattern recognition. Look below for more explanation on what we talked about.